There's the occasional eyelid lift patient who comes in and asks if the procedure in any way will affect their vision. So we thought that would be a really important thing to sort of address with both the upper blepharoplasty as well as lower blepharoplasty.
So in short, the answer is it should not affect your vision at all. Really, when we're talking about blepharoplasty, it's important to understand exactly what's happening during an eyelid lift procedure. We do want to screen patients for any potential eye issues that they might have had pre-surgery, the most important one being whether they have dry eye or problems with their vision before surgery. That's something that your surgeon should know about. But we'll talk a little bit about the procedure and why that shouldn't be an issue.
Yeah, typically speaking, if you're just talking about an upper eyelid lift, the incision is placed in the crease of the eye itself, and it's really a procedure where most of the procedure is just removing some of that extra skin. Some surgeons will go ahead and take another little band of muscle as well as the skin. None of this should affect vision in any way. Occasionally, for the better, if your eyelid skin is really draping, we're talking generally older patients where they've got significant ptosis. Those patients will say that they've got some peripheral vision loss that can be tested for, and the procedure actually afterwards will produce some improvement in their vision.
It's important also to go to a surgeon who has experience with eyelid lifts, because they'll really understand the correct amount of skin to remove during the procedure. If the surgeon is being over-aggressive with skin removal, there can be an issue sometimes with, certainly in the first few weeks, the lid not being able to close properly or having some issues with dryness with that. With lower lids, the incision for most patients goes right below the eyelash line and right into a crease. That's what's called a skin muscle eyelid lift. And through that incision, you're actually able to take out the extra skin and muscle, tighten it, and that gives a really nice improvement to the lower lids. In contrast to what a lot of surgeons did many years ago, which was going into the eye itself and removing some of the fat from that area, the trend in the last many years for almost all surgeons has been to move away from taking away fat from the lower lids. And so the risk of a vision change or problem with vision after surgery has really gone down tremendously.
Yeah, if you're looking at this, you've probably heard about fat transfer. A lot of that has to do with this real movement away from removing volume. What often happened when you took that fat through that transconjunctival approach was you took the fat out, the patient looked good for a couple of years, but long term they got that sunken, really hollowed effect that made them look older. That's not the technique that most surgeons will approach now.